Mr. Ang and Dr. Chia also asked about the progress of the development of the Standard Integrated Shield Plan, or Standard IP. Let me first talk about Integrated Shield Plans, or IPs. IPs comprise two parts. The first part is a basic MediShield portion run by the CPF board, and this portion is the same for those without IPs and for those with IPs. They are the same. With MediShield Life, when MediShield Life is implemented at the end of this year, it will automatically replace the MediShield component. The second portion is the additional private insurance coverage run by private insurers, typically to cover classes A and B1 in public hospitals or private hospitals. In other words, all IP policyholders are already covered by MediShield today, and they will be covered by MediShield Life in time to come. Similarly, IP premiums also include MediShield premiums. There is therefore no double coverage and no double premium. Many Singaporeans also shared that it was difficult to compare IPs and wanted a standardized option with enhanced coverage beyond class B2 and C. So Ministry of Health has been working with the integrated plan insurers to develop a standard IP based on coverage at class B1 wards. Benefits will be aligned across all insurers so that the plan can be easily understood. Those looking for enhanced coverage that is more affordable than class 1 or private hospital plans can consider this plan, standard IP plans. We aim to introduce the new standard IP plan in the first half of 2016, soon after the rollout of the MediShield Life this year. This will give time for Singaporeans to focus on MediShield Life and better understand and adjust to the changes resulting from MediShield Life before we make changes to the IPs, before the changes to the IPs are made. To help policyholders to make informed decisions about buying IPs, MOH is working with MAS, Monetary Authority of Singapore, to ensure that insurers present their products more transparently and more accurately. This will also address Dr. Chia's concern on IPs. Most Singaporeans use MediSave to pay for MediShield and IPs. Since every IP policy comprises two parts, it is also timely to consider restructuring the MediSave withdrawal limits, or MWLs, for health insurance premiums also into two components. Today, the MediSave withdrawal limits, or MWLs, apply to the total IP premium, combining premiums for MediShield and the additional private insurance coverage. Singaporeans are not aware of how much MediSave is being used for MediShield and how much is directed towards the additional private insurance component. With MediShield Life, we will give Singaporeans more certainty by ensuring that MediSave will always be allowed to cover the net MediShield Life premiums, including additional premiums, if any, and after subsidies. There is therefore really no need to set a withdrawal limit for this component that applies to the MediShield Life premium. But beyond this, there will be an additional withdrawal limit, or AWL, that will apply to the premium for additional private insurance coverage only. So today, the withdrawal limits applies to the entire premium of the integrated plan, which comprises two components, the MediShield and the private coverage, private insurance coverage. Going forward, we will restructure this withdrawal limit. We will cover the entire premium that is applicable for MediShield Life for everyone. And therefore, there is no need to set a limit for the withdrawal to pay for MediShield Life premiums. But we do need to set a limit for the private insurance component, private insurance coverage. And that limit will be called the additional withdrawal limit. And that limit, the details of that limit, we will share with Singaporeans later. In setting the new additional withdrawal limits, we will have to balance between helping Singaporeans pay for their IP premiums using MediSave and ensuring that they have enough MediSave for their other healthcare needs.